Hey everyone, and welcome back to my series on vasoactive medications. If you're new here, my name's Cody Summers, and my goal is to help nurses and healthcare professionals better understand the medications that we use every day to manage our critically ill patients. In this video, we're going to be looking at phenylephrine, which is a powerful medication commonly used to manage low blood pressure, especially in the ICU and in surgery with general anesthesia. Phenylephrine, also known as neosynephrine or just neo, is a sympathomimetic drug, which means that it mimics the effects of the sympathetic nervous system, which is responsible for the body's flight or fight response. It's a vasopressor and alpha-1 adrenergic agonist. In simpler terms, neo causes blood vessels to constrict, which helps raise blood pressure. But what exactly does Neo do and why is it so effective? Well, let's break it down. So Neo works by directly stimulating alpha-1 adrenergic receptors that are located on blood vessels. These receptors trigger vasoconstriction, so basically the tightening of blood vessels. This constriction reduces the size of the vessel's lumen, which increases resistance and raises blood pressure. One kind of example I like to give is if you were to have a water hose in your hand and you put your thumb over it, as you increase pressure, it's going to shoot further. That's basically what we're doing here. We're just kind of squeezing though. However, unlike other vasopressors, Neo primarily affects blood vessels, and it doesn't significantly increase the heart rate. So Neo is often used in clinical settings to treat hypotension, particularly during surgery or in patients that are undergoing anesthesia. When blood pressure can drop due to the effects of certain medications such as propofol. It can also be used in shock states, especially septic shock, to maintain perfusion to vital organs. Because Neo increases vascular resistance, it helps to stabilize blood pressure very quickly. So let's talk about the dosing and how Neo is administered. Dosing will depend on the indication, and it's somewhat different from other drugs that we've talked about. None of the other drugs we really ever want to bolus, unless it's epinephrine in an emergency situation or a code situation. However, Neo is kind of different in that way. So often Neo is given via IV infusion, usually starting at 20 mics per minute, and at our facility our max is 200 mics per minute. But it can also be given in emergency situations with critically low blood pressure as a bolus dose of usually anywhere from 50 to 100 mics per push, usually up to a max of 200 mics per provider preference. We usually refer to these as Neo sticks, and they can really be useful, especially in emergency situations. But always remember, a central line is preferred due to the risk of tissue necrosis with extravasation, because it is a vasopressor and it will cause tissue damage. So like all drugs, Neo does have some potential side effects. It's important to be aware of them if you're given this medication. Reflex bradycardia is the big one. Since Neo raises blood pressure, what can happen is it can trigger baroreceptors that are in the body, especially in the carotid arteries and the aortic arch. And basically, the triggering of these baroreceptors sends signals to the brain, which stimulates the vagus nerve that causes reflexive slowing of the heart rate. And it's basically just the body's way of managing a rapidly rising blood pressure. The body's just trying to maintain homeostasis. Along with that, obviously we don't want to give neo to a patient with hypertension, as this may cause a dangerous rise in blood pressure that could lead to stroke, myocardial infarction, or even organ damage. And additionally, as I've mentioned before, neo can cause tissue necrosis if extravasation occurs, so a central line is definitely preferred here. So let's look at a quick case study and just kind of see how neo's used in a real world scenario. So we got a patient here. She's 58 years old, and she is undergoing a cholecystectomy with her baseline blood pressure 145/85 prior to induction of anesthesia. As we get the case rolling here, propofol and fentanyl are given for induction of general anesthesia, and blood pressure drops to 85/45 due to the massive vasodilation caused by those two drugs, propofol and fentanyl. The initial efforts to increase preload by giving fluids are unsuccessful, and so the anesthesia provider decides that a 100 microgram neo bolus should be given. So they give it. The blood pressure improves to 115/75, and a neo infusion is started at 30 mics per minute to maintain the patient's blood pressure throughout the rest of the case. So this case just kind of highlights the potent vasoconstrictive effects of neo and why it's commonly used in surgery, especially after the induction of general anesthesia. Those medications that are used cause massive vasodilation, and so neo is a real quick way to just kind of tighten things back up. So we can compare neo with a couple of medications. Neo is different than norepinephrine and epinephrine in that you have less risk of arrhythmias. If you'll recall, norepinephrine and epinephrine have beta-1 activity, which means that they stimulate receptors in the heart that causes inotropic effects and chronotropic effects, even dromotropic effects. Neo doesn't have that. So neo is primarily working on the blood vessels, and so if your patient has a lot of arrhythmia, maybe neo is a better medication so that we don't possibly send the patient into VTAC or atrial fibrillation with rapid ventricular rate, or anything like that. So some key takeaways. Neo is a potent vasopressor with clinical and critical applications in managing hypotension. It stimulates alpha-1 receptors to increase vascular resistance, which then increases the blood pressure. It's very useful in ICU settings, surgery, and especially anesthesia. Just make sure to watch out for that reflex bradycardia. So thanks for watching, guys. I hope you found this video helpful, and I'll see you in the next one.